Hi everybody, this is Jim from the Pain PT here. We're going to talk about spinal imaging findings, more about normal aging than pathology. This is great information. This is the latest in science here that shows that most of the structural changes we see in the back and the neck are actually part of a normal aging process and nothing pathological and nothing abnormal. This is really important to understand because especially with chronic pain, a lot of patients hang their hat on these structural changes being the cause of their pain, when we actually know that it's more about the brain and nervous system, as you may have seen in some of my other videos here. Let's get to the data. So this first study was done in New England Journal of Medicine, one of the better medical journals out there, and it was done over 25 years ago. And what they did was look at close to 100 asymptomatic participants. These people had zero back pain. They took MRIs of all these people, and here's what they found. Only 36% of all these asymptomatic people had normal discs. Over half of them had a disc bulge at one level, and more than a quarter of them had a disc protrusion. They also found close to 40% of these people had an abnormality of more than one disc. So what they concluded, the authors concluded, was that many people without back pain have disc bulges or protrusions. The discovery by MRI of bulges or protrusions in people with low back pain may frequently be coincidental. So this was 25 years ago. Unfortunately, this didn't shift the practice of doing a lot of MRIs and CT scans of people's backs. It was business as usual over the last number of years. Let's look at the data now to see what it shows. This was a systematic review, and one of the best things about a systematic review is that it pulls together the data from a number of studies. And in this case, they looked at 33 spinal imaging studies, all in people who had zero pain. These people were asymptomatic. Over 3,000 people who had a CT or MRI scan done of their spine. And what they found, looking at all the data, was this. Our study suggests that imaging findings of degenerative changes are generally part of the normal aging process rather than pathological processes requiring intervention. They go on to say that the finding that more than 50% of pain-free people from the age 30 to 39 have disc degeneration, disc signal loss, disc height loss, or bulging discs, and that this suggests that degenerative changes may be incidental and not causally related to presenting symptoms. So this is a really powerful study because of all the data behind it. Let's continue on here. What came from this study was a really cool table here. It shows you by decade level the percentage of spinal degenerative changes that occur in the population. These changes occur in people who have zero pain. So just take a close look at that. You can see a large percentage of changes occur in the normal population without pain. And as we get older, the number of changes increases. Another common thing we see, spinal stenosis. We see this diagnosis a lot in older people. So this study actually looked at almost 1,000 people. The average age was 66 years old. They took MRIs of the spine. And what they found again was that 77% of these people had moderate central stenosis, and 33% had severe central stenosis. So they found that they had some evidence that if you have severe central stenosis, it can be related to pain. However, in this study, only 17.5% of participants with severe stenosis actually had symptoms. So they concluded that although X-ray lumbar spine stenosis was common in their study population, symptomatic persons were relatively uncommon. So again, this is just another finding that we are seeing on imaging scans that has no basis in causing pain. And we need to understand and learn more about this so that we don't receive false messaging from the medical providers. So I'm going to culminate here with this last opinion piece that was done in 2019 and the Journal of the American Medical Association. This was posted in the Washington Post. And basically what they're saying is that we have an addiction to unnecessary MRIs and CT scans, whereas most of the time we're not finding anything significant. If we rule out cancer and tumors, which is basically between 1 to 2% of all imaging scans, everything else is not usually clinically significant. Can be, but not usually. The authors state here that there's virtually no evidence that screening of this kind improves overall population health. The authors also admit it's going to take a lot to wean Americans off their addiction to medical imaging. These mostly incidental findings, just like we saw in the last few studies, can serve as red herrings, causing diagnoses that aren't useful, leading to treatments that don't work, and causing stress and anxiety to patients. We really need to look closely at what we're telling our patients, the message we're giving our patients, and look at the whole situation, the whole story of the patient, not just the MRI, the X-ray, the CT scan. This is a very small piece of data, and most of the time what we see is normal aging-related changes, not pathological abnormal findings. I hope this is helpful. Please, if you have any questions, reach out to me at thepainpt.com. You can email me at jim@thepainpt.com as well. And please have a look at some of these other videos. I'm hoping to shed some light, especially with chronic pain, on the nature of chronic pain, and also to dismiss some of these other, what we call abnormal findings. Thank you very much.